Baby nurses, listen up. It is NCLEX time. If you are terrified, hit like, hit follow. We've got you covered. You're not in this alone. It's kind of like your on-the-job training. Your ability to think like a nurse starts right here, right now. So what we're trying to do here is give you a framework that you can kind of keep in the back of your head when you're doing your questions and you're going over your rationales and you're trying to really figure out what they're trying to get out of you by asking these questions. Let's get into it. So we're going to drill down right now into some clinical judgment, and we're going to start off with recognizing cues. This step is crucial. Look at your patient, see how they're doing, evaluate vital signs, lab values, color, rate of breathing, everything they have going on. Don't forget, if you miss this step, it could equal delayed intervention. In any given question, these can be very subtle signs or they can be really obvious. So now we're going to analyze it. This is where we're going to analyze our cues. You're going to get many questions on this where you're going to have 4 or 5 patients. They're going to ask, which one do you see first? This is when you have to take your cues and put it in your database, which is your brain, and try and figure out what does it mean. So as we're analyzing these cues, we're trying to figure out what's happening, how urgent is it, and what's the potential cause. Remember, especially with like respiratory patients, something as simple as lifting the head of the bed up, pretty easy fix, right? So analyzing these cues accurately, putting them through a good processor, make sure that your interventions are targeted and effective. Next up, we have to prioritize our actions. What you going to do? We're going to evaluate your outcome now. Did your intervention achieve the desired effect? Prioritization is a key NCLEX tool, and it equals safe practice and exam success. Evaluating outcomes is your pivot point. At this point, you either establish success and you've done a great job, patient care improved, or you need to re-intervene. And this part's going to be either about success or further intervention. Very important. If the care needs to be modified, it needs to be done immediately. So that's going to be the basic framework that I really want you to keep in mind as you're doing your questions. And I want you to do as many questions as you can. You keep sharpening these skills and you'll be ready for both your exams and your patients.